Good morning, everyone. Here we are again in integrative medicine. I'm Quincy Perry, and today I'm going to be talking about cryotherapy as a modality. Without further ado, let's get right into it, talking about the mechanism of action, physiological effects, indications, contraindications, side effects, treatment plans, and limitations of cryotherapy. So the vision here, again, is to introduce cryotherapy as an integrative modality and highlight some impacts on animal care. So the mechanism of action involves three main steps: heat transfer, cell injury, and inflammation. So the heat transfer will happen when something really cold is applied to, let's say, the skin, for example. So in this case, we would use liquid nitrogen, which has a boiling point of, I believe, negative 196 degrees Celsius. So as soon as that nitrogen hits the skin, it is going to transfer the heat from the skin onto nitrogen and evaporate off. So in other words, it's going to be used to chill the skin. So as the skin cells thaw out, they're kind of overwhelmed, start to collapse and die. And so then after that, inflammation will then take over to clear out the dead skin cells. The dead skin cells are then neatly packaged into and discarded, and these are known as apoptotic bodies. So as you see here on the left, here are some results from cryotherapy of these skin lesions. So as we can see, this may be an effective modality for a lot of benign skin lesions. So uses and cautions. So our indications are usually going to be skin tags, warts, cysts, hyperkeratosis, ulcers, other benign tissue growths, and it also can be used for joint pain and stiffness from osteoarthritis. Some contraindications will be areas with loss of sensation, peripheral nerve injury at the site that we're trying to work at, any malignancy of any mass in that certain area, a previous cold injury at that site, and poor circulation at that site. Limitations of this include certain microscopy techniques, such as histopathology, cannot be used once cryotherapy is done. Cryotherapy at first may cause sort of a ugly, leave an ugly remnant behind before any healing gets done. There's usually scarring and some hair loss at the site of injury, and a possible need for repeat procedures in order for it to be fully efficacious. So the treatment plan typically for growths will be repeat freeze thaw cycles until the lesion has fallen off. Hopefully you only do it once or twice. For pain and inflammation, though, we're going to be not necessarily freezing things, but more so a series of controlled cold therapy sessions just to reduce that swelling, numb those nerve endings, and then promote healing. Thank you very much, and here are my sources. Thank you and have a good day.